Hey everybody, my name is Chloe Walton, and today I will be talking about sleep disorders, if you cannot already tell by my attire. And the sleep disorder in particular that I will be discussing today covers obstructive sleep apnea hypopnea, as you can see here. First up, we will be discussing the characteristics of this disorder. Here we have an image that depicts the differences between a normal airway, which shows to have more oxygen rather than carbon dioxide that's being taken in, and there is no blockage, whereas someone who has OSA has a blockage that is shown by the red arrows and has more carbon dioxide buildup rather than oxygen, which creates these issues. Alright, so before I get into the specifics of the symptoms and characteristics of this condition, I wanted to give some vocabulary. Apnea is the medical term which means without breathing, and hypopnea means lower or insufficient breathing. And according to Johns Hopkins Medicine, hypopneas actually occur for more than 10 seconds at least 5 times throughout someone's sleep period who has this condition. And it can interchange between hypopnea and apnea depending on how severe the obstruction is. So looking over at our table, we have a bunch of different lists of symptoms that could potentially affect someone with this condition. And so some of them that I wanted to address in specifics are the nocturnal breathing disturbances, which include snoring, snorting, gasping, or breathing pauses during sleep, as well as daytime sleepiness and fatigue. Snoring is definitely one to take note of. It's normally very increased in volume, and there are a lot of breathing pauses during sleep, which is typical of this condition as there's a little less airflow coming in and out. So there's a lot of stops. And the daytime sleepiness is also something to take into consideration because they can't get the amount of oxygen needed. It affects their sleep, which then affects how they carry out their day. Down towards the bottom here, it has a list of the severities, which severe is at the bottom, but it's considered by an AHI index, which is Apnea Hypopnea Index, and it can range from 0 to a little over 30. But typically, someone who has this condition has it from the ranges of 15 to 30. And what that means is that there are about 15 to 30 or more obstructions of apnea and hypopneas that are occurring during someone's sleep period. Next up, we're going to talk about the prevalence of obstructive sleep apnea hypopnea. And before I even go into this, about 90% of people who have this condition actually don't even know that they have it, so it's very underdiagnosed. And not so fun fact, about 2% of children actually have this condition. So the percentages are a little weird. As you can see, it's more common in males rather than females, but there has been a surge in the prevalence. It's not a super rare condition, but it's growing in its commonality, which is a good thing because if people are able to diagnose it earlier on, then they can treat it better, but it's also not so great of a thing because so many people either have it or may have it, and it's just a little unfortunate because now they have this condition. But nonetheless, it's being treated, and that is the best part about it. The age of onset is literally everybody. As I mentioned before, about 2% of children have this condition, but it mostly occurs in like the middle-aged individuals and adults. And for those who are obese or growing in age, typically the elder range, the prevalence increases with these groups of people. First up, we will be covering the theories that are associated with the sleep disorder of obstructive sleep apnea hypopnea. First up, we have this theory that there is a decrease in memory when someone may have obstructive sleep apnea hypopnea. So as we all know, breathing influences how our brain is able to function. If there is a lack of oxygen flow to the brain, then there are some potential physiological and psychological conditions that may occur as a result. And specifically, with this particular condition, it could affect our processing of memory during sleep. And there are 2 types of things that affect these particular processes: sleep spindles and slow oscillations. And just for some definition purposes, sleep spindles are moments during our sleep when there's a lot of neural activity, specifically with memory, and this is done by the hippocampus and different types of neural cortexes that occur during our sleep period. Next up are slow oscillations, which are moments of hyperpolarization or just kind of downtimes that our brain experiences during neural activity, which the neural activity is stemmed by these sleep spindles. So these two things are very important to take into consideration because they actually are used to help with our sleep rhythms and help with proper rest and memory processing. So when we have an impairment of breathing, there is then an impairment of sleep rhythms, which suggests by different types of researchers that obstructive sleep apnea hypopnea may be a potential correlation with memory and cognitive dysfunction. Once again, this is still a theory and is still being researched, but until then, just something to be aware of. So the next theory is that major depressive disorder, or MDD, is a comorbid condition of obstructive sleep apnea hypopnea, meaning that they kind of go together. And so with MDD, there is said to be a 5 times more likely prevalence to develop sleep apnea. About 20 to 40% of people actually have both, and they actually share similar risk factors and symptoms. However, this is the theory in itself, that they share several similar things, and that's where the question of, are they a cause of one another, or are they their own different types of conditions that actually just happen to share similar things? Because according to certain research, it is said that they both share different types of sleep fragmentation, biological disorders, metabolic syndromes, and other mental diseases of the central nervous system. And certain types of drugs also cause the same type of symptoms in both MDD and obstructive sleep apnea hypopnea. So, strictly a theory, they're still researching into it, but there is this question of that they may be causes of one or the other. Next up, we have the treatments that are used for this disorder. First up is the most common and successful form of treatment for obstructive sleep apnea hypopnea, which is the CPAP machine, which means continuous positive airway pressure. And basically what it does is there's, like it says, a continuous flow of positive air pressure that is pushed into the airway, and it allows the airways to open up any blockages that may be there and avoid any obstruction throughout sleep. There are some co-treatments that go with this. Patients say that there is an improvement with their breathing when a humidifier is used with the addition of a CPAP, as well as adaptive pressure. There is a noise complaint, though, that is associated with this treatment because these machines are very noisy and loud. However, they are trying to create new types of machines that are a little bit quieter for those who may be sleeping with other individuals in the area. Alright, so here are a few pictures of the different types of masks and mouthpiece that are used with a CPAP machine. So the top left is called a nasal pillow mask, which allows for a lot more motion and movement, as you can tell in comparison to the other mask. The top right is called the nasal mask, which is used for patients who have a higher severity or may move around more in their sleep, so it's just a stabilizer. And the bottom mask is called the full face mask, which is used when breathing nasally is obstructed, and it's for those with a tendency to sleep with their mouths open. So the next type of treatment is behavior or behavioral remedies, and these are things that patients can do on their own. So first we have positional therapy, which consists of side lying. The way in which someone lays it when they go to sleep is actually a big factor in how much an airflow is able to be opened and avoid blockage. So this is done with foam positional pillows that can be positioned in certain ways in which the patient can allow for that better airflow. There's actually a tennis ball method where you can tie a tennis ball to your back to avoid lying on your back, which could sometimes cause issues with blockages. There are also some weighted or alarm harnesses that allow you to stay on your side and to keep from going on your back. The other one is weight loss, so this is for those who may be on the more obese end of things, which is our more prevalent people who may have this condition. In this picture, we have someone who was more on the obese side and then lost some weight, and you can automatically see the way that the passageway for air is just so much clearer, and there's not so much blockage and tension placed on the neck. Next is alcohol and sedative avoidance. Research shows that these types of drugs and depressants can lead to relaxed muscles in the airway, which causes obstructions and potential apnea. So just following these 3 type of things are actually very helpful and beneficial. To the right, you can actually see the tennis ball method, where someone just tied a tennis ball to their back, and to the left, different ways that someone can position those foam pillows for better airflow. I hope you've learned something new about this disorder, and I hope you've enjoyed.